More than 4.8 million eligible persons in Nigeria have received their first dose of COVID-19 vaccines, according to the National Primary Healthcare Development Board. This represents 4.2% of the over 100 million eligible population who are targeted to receive full doses of the vaccines for Nigeria to reach herd immunity. Today on Sound Health, our focus is on how to achieve high vaccination rates. I am Olasumbo Modupe. Thanks for staying with us. The program continues with COVID-19 updates. Please stay tuned.
Over 5 million people have lost their lives to COVID-19 since the discovery about 2 years ago. Low-income countries, most of them in Africa, have received just 0.4% of the COVID-19 vaccines, while more than 80% have gone to G20 countries. Regardless of the situation, the World Health Organization says it welcomes support for the set target to vaccinate 40% of the population of all countries by the end of this year and 70% by mid-2020. The organization added that 82 countries are at risk of missing this target. For most, the barrier is not absorptive capacity, it's insufficient supply. WHO called on countries that have already reached 40% to swap their vaccine delivery schedules with COVAX and AVAT, support local vaccine production in Africa, and make good on vaccine donation promises as urgently as possible. Countries must also fully fund the Access to COVID-19 Tools Accelerator, which needs $23.4 billion over the next 12 months to get tests, treatments, and vaccines to where they're needed most. The Lagos State government has commenced the mass vaccination campaign as part of strategies to stave off the reemergence of the COVID-19 viral infection. The accelerated vaccine rollout tagged Operation Count Me In targets vaccinating 4 million residents against COVID-19 before the end of 2021. The exercise, kicked off by the State Primary Healthcare Development Agency, is free of charge in public health facilities.
Still Sound Health on Lagos Television. Giving more insights on achieving high vaccination rates is John Akinola, Program Manager, Freedom Foundation House of Refuge Rehab. Thank you so much for joining us, Akinola, this afternoon.
The pleasure is all mine.
All right. How do you think the country has fared in the vaccination campaign?
From what I've seen so far and from the figures, we're not doing too well at all. And what I mean by that is look at the statistics that we're seeing. Out of a country of over 200 million people, we have just barely over 4 million that has taken their first dose, and over 1 million, a little bit over 1 million that has taken their complete vaccine. And going by the situation of COVID-19 in the world, I expected more. I expected more people to be willing and be ready to be vaccinated. And I feel the government needs to do more in the area of campaigning for people to get vaccinated. So we're not there. We're just trying. Let me put it that way.
All right. Do you think Nigerians are not hesitant about vaccinations now because there are no surplus vaccines, unlike what the federal government is saying that residents do not want to get the vaccines. Do you think there's actually vaccine hesitancy in the country?
Yes, there are, and the issue basically it's like the way and manner we campaign for getting vaccine. It's not. I feel that when something needs to be done, it needs to be done well. In the case of this COVID-19, the fact that a lot of people are aware that there is COVID-19, but they are being receptive about taking vaccine is another thing. So if a lot of people are aware that COVID-19 is more or less like a deadly pandemic that is ravaging the whole world, then there should be enough campaign that can enable the residents of Nigeria to be able to accept the vaccine. Yes, we don't have enough vaccines that can go around, but even the vaccines that we have we collected it as we don't have enough people going out there to access the vaccine. So it is important that government do a lot to create more awareness when it comes to letting the residents of Nigeria know that they need to access vaccine and where they need to access the vaccine. Yes, we did a lot of campaign when it comes to creating awareness. Now everybody is almost everybody is aware that there is COVID-19. But are we putting in that same effort to vaccination? I'm not sure that is what is happening now. That's showing that's why a lot of people are receptive in Nigeria, and a lot of myths are going around on vaccination. So we need to clear the air, and the government needs to do a lot to clear the air.
Okay, considering the scenario you just painted now, what are your thoughts about effort by the federal government to penalize eligible Nigerians who refuse to get vaccinated? I know some states have started, Edo and Osun State. The federal government also plans to mandate civil servants to get the vaccines now.
Well, for me, that's the wrong turn. We don't need to penalize anybody for not taking vaccine. We need to look at the root cause of people. Why? We need to ask ourselves, why are people very redundant when it comes to the vaccine? Why are people not willing? What is exactly going on? What are the information that is available out there for people? You know, that there are levels of information that needs to be cascaded down to a common Nigerian man that does not even look at the TV, that does not even hear the radio, that is just about his daily bread. So there, and I call them pepper soup discussion because they get some of this information around, information that are just flying. So they just grab it and they transfer it like rumor. When they say, okay, when you take vaccine, something is going to happen to you. You know, that kind of a thing. So all of those information are not well cascaded down to the common Nigerian man. And that is why we don't need to now take the harsh way to make it compulsory for people to take vaccine. Don't say you punish people or penalize people if they don't take vaccine. It has to be, everybody has their rights. And we have to also understand that the right of an individual needs to be put into context. And we have to do it from a right-based approach. My counsel to the government is that they should look at all the stakeholders that will infiltrate a common Nigerian man to influence them to be able to influence the common Nigerian man to be able to willingly want to take vaccine and not coerce people or force people to take vaccine. No, that's not the right way to go about it, because a lot of uproar is going to come out from that. If it is passed into law that you must take vaccine or else you face some what's it called, some penalty, then you will see people coming out and ganging up and saying they want to do a lot of things, protests and things like that. But let's look at the root cause. Why? Let's ask ourselves that question. Why are people not willing? What are the things we need to do? And once we ask ourselves, we get to the root cause, then we build on that and we focus on the intervention that can bring about acceptability. So it is not the right way to go about when you say you want to force people or force people to take vaccine. states that have started, you know, I'm believing that when they start implementing it full-fledged, it's going to affect a lot of people, and you will see the uproar. You understand?
All right.
So let's not go that route at all.
Okay, it's already playing out in Edo State. Some members of the public in Edo State are already protesting now. So we are all also hoping that it does not snowball into an issue that will go out of hand. So let's look at racketeering of vaccine certificates now. Is it a question of morals or values? Why would anyone get a fake vaccination certificate now?
Well, you know, Nigerians are very, very sharp, and we are very intelligent. And when we hear racketeering of certificates, to whose detriment? That's the first question we should ask. If you are not vaccinated and you buy your way into getting the certificate that you are vaccinated, who are you helping? Is it the person that is giving you the certificate after collecting your money, or yourself? Let's ask ourselves that critical question, and it still brings me back to what I've been saying from the first question. Government needs to cascade the right and correct information to the common man. Yes, a lot of people go through, you know, the process of people getting tested for COVID-19 is traumatizing for some people. And if care is not taken, some people are not willing to go for vaccination. And if they say, okay, because we are forcing you to take vaccine, people will want to buy their way out of it now. And that's what they're saying. That's why a lot of people are now trying to buy their way to get certificate. Okay, yes, I've been vaccinated. If I have a certificate, I've been vaccinated. That is what we will achieve if, in this kind of system that we're running in Nigeria, if we start enforcing vaccination. But I feel that if the right thing is done, the right information is cascaded, everybody will be willing, and no one will say, okay, I want to go and register or get a fake certificate that I've got to vaccinate. It's not the right way, actually. But, you know, it is something that we are being, let me put it that way, people are being forced to do it because there are certain things that privileges that are not available to anybody that has not received COVID-19 vaccine. And we are graduating into that. There are some countries that you cannot enter without getting vaccine. That's what we are graduating into. But have we provided adequate information? Have we provided enough information that will reach the common man, that will reach the smallest unit of a society? Are we using the stakeholders, the critical stakeholders that we have in all places, in all the strategic places that cascade adequate information? Is our religious body fully involved in it? Are the imams going ahead to tell people that you need to take vaccine? Are they explaining all of these things to their congregation? Is a pastor, a bishop, are they doing that? All the traditionalists, are they trying as much as possible to cascade this information in the right language that it the common man will understand? I know the media, they have been doing a lot of campaign. I hear a lot of things, I see a lot of things on TV and on radio. But it is not enough because not everybody listens to radio. Not everybody is watching TV. Most people, if they are not on internet, they are on the way trying to get their work done. So a lot of things, we should not now look at it that, okay, yes, people are racketeering certificates. We should now look at it that what is the information that we cascade and make it as simple as possible for everybody to accept. Let's segregate the information to every channel, every media channel, that everybody will accept it the way they need to accept it. So it is normal for us to have that in the Nigeria that we have today. And if enforcement is put into full action, you will have a lot of people buying their way out to get COVID-19 certificate of vaccine.
All right,
We
this
shouldn't go there. We
okay.
shouldn't go there at all.
All right, this level of skimming is also seen at our international airports now. Some travelers are already evading COVID-19 PCR tests. Now, what do you think the government must do to discourage people from going that route now?
You see one thing, a system that is how will I call it now? That is having corruption majorly at many of the airports that fear. You cannot say all of these things not come to play in some countries, or especially in Nigeria. But the major thing I would advise the government to do in cases like this is to place stricter measures in our border places, that one of the airports, and making sure that everybody that is coming into Nigeria, if you are buying your way out of getting vaccine or something, or vaccine certificate, you should be able to provide evidence. And I know many countries will not just say, many people in different countries will not fall victim of this racketeering of certificates. And if they are even falling victim, a thorough test should go through for everyone that is coming into the country. So if government wants, our government, if they want to do something, they will do it, except if they don't want to do it. If they want to achieve high rate of vaccination, they can achieve it within period of whatever period of time they've stated for themselves. They only just need to use the right strategy. In the case of people coming into the country or going out of the country, they just need to put the right policy in place and put the right people that can handle the policy to the letter. Because a lot of people don't even understand. Even the people that are screening at the airport, some of them are not even vaccinated. Some of them don't believe this thing. You will hear some people, they will say another thing on air. And when they come to their, they will say another thing. I don't even know this vaccine. They will now, you understand. So all of these things are basically what is affecting the mindset of everyone that is at the helm of our affairs when it comes to COVID-19. So if the right information is cascaded, if the right policy is put in place in at the airport, and the right set of people are put in charge of this, they will do the needful, and we will be having people infiltrating us and also find their way into the country or out of the country without going through the right processes.
All right.
That's what I think.
All right. As a key player now, what approach or template should be taken or should be embraced by the federal government to shore up the statistics now?
I mentioned something that we need to strategically look at how we can infiltrate the key stakeholders and cascade information at various levels. Cascade information at various levels, because the federal government is there, up there. The local government, the state government, the local government,
the CSOs.
Everybody has to be involved. Everybody has to be carried. Everybody has to be carried along, and the information needs to be clearly spelled out. So it's not in a way that everybody. Yes, there are a lot of myth that is flying there. A lot of rumors that if you take vaccine, you put a spoon in your shoulder and it will stick there. It is a lie. All of these things are rumors that people are just creating to prevent people. Remember the 5G issue?
Theory.
The 5G theory. A lot of people are still believing that theory till date. Like the program we ran when we were working with under Agent for Citizen-Driven Transformation project. last year during the COVID-19, each of the COVID-19. It was an online program. We first and foremost give information on correcting all the myths that people have, notions that people have created in their mind, and then giving them the correct and adequate information as to their levels. Because a lot of people don't know. I call this pepper soup discussion that they discuss around every joint, every they don't listen to TV, they don't watch TV, they don't listen to radio, they don't even hear all this information. So they just hear from one friend and just carry, amplify it and misinterpret it. And that is what all the information that and we have the right channel. If government wants to do this, first and foremost, identify all the critical stakeholders that are involved in giving information to the least person in Nigeria. That's the commonest person, the person in the village setting. So once you identify all those critical stakeholders, organize how you can cascade the adequate information that is needed, that will not misinform them, and they will. How did we achieve measles vaccine, polio vaccine, and all of these vaccine intake? It's not when we work with the stakeholders, work with the community members, work with the individuals that are involved. Because if somebody in a community setting that they look up to their imam or look up to their community leader or their pastor, and you just tell the pastor, please take your vaccine in the presence of your congregation. Do you know that everybody will also to do that? Any imam that does that, every of his congregation member will do that. So it is something that we need to. It's not by force, but we have to provide this information in a way that is acceptable to the common man, and that is how we can achieve success with COVID-19 vaccine.
John,
a lot of people are still dying. A lot of people are still getting infected, and they are not going to stop. My counsel to everybody is to make sure you get vaccinated. Now that they're available, you get vaccinated. Thank you very much.
John Akinola, Program Manager, Freedom Foundation House of Refuge Rehab. Thank you so much for your time and resources this evening. We really appreciate you.
Thank you for having me.
All right, Sound Health continues with trending health reports. Please stay tuned. This is all we have time for today on Sound Health. Vaccines are free, safe, and harmless. Get vaccinated today if you are eligible. Remember, you also need to carry on with all precautionary measures even after vaccination. Wash your hands with soap and water for 20 seconds or with alcohol-based sanitizer. You also need to wear your mask and avoid large crowds. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social. #SoundHealth. A sound health is a sound mind. Make healthy living your choice.